Good evening, everyone. Thank you so much for joining us this evening. My name is Melina Davis, and I'm the CEO and the EVP for the Medical Society of Virginia. We founded SafeHaven. Virginia was the first state in the United States to seek protections and build a program specifically to help clinicians and make sure that they were able to seek confidential behavioral support when they needed it. We launched the program in 2020 and in Virginia, and we've since made the program available nationally. And tonight, you folks will hear more about the program, but also are working in partnership with ASCO and with VITAL WorkLife to make this a successful effort and a successful program for you. I'd like to welcome an amazing panel this evening. I'd like to take a minute to just introduce each of them. Karen John Manuzza. Karen is the Physician Wellbeing Resources Senior Consultant at VITAL WorkLife. She's worked in the behavioral health field for over 20 years. The last 8 as part of a large healthcare system in Winston-Salem, North Carolina. Karen found her niche in supporting individuals, groups, and organizations in healthcare and has successfully supported individual physicians and other healthcare employees toward balance and meaning. Karen has a master's degree in counseling and is a licensed clinical mental health counselor and a certified employee assistance professional. I'd also like to welcome Dr. Susan Wilson. She is a retired emergency physician and certified physician coach. She has been a peer coach for VITAL WorkLife since 2020. Dr. Wilson is certified through the Physician Coaching Academy. She's a member of the Physician Coaching Alliance and serves as a volunteer physician coach for the California Medical Association. With over 25 years of clinical experience, Dr. Wilson has seen the evolution of medical practice and witnessed firsthand how these changes have impacted her colleagues. Dr. Wilson sees coaching as an important tool to address issues of job satisfaction, work-life balance, and burnout among physicians. Also joining us tonight is Dr. John Burke. He has earned his undergraduate degree from Harvard University, where he graduated magna cum laude with an AB in history and science in 1992. Dr. Burke went on to earn his medical degree from the Baylor College of Medicine in Houston in 1997, where he graduated with honors as well. He completed a residency in internal medicine at the University of California at San Francisco and a fellowship in medical oncology and hematology at the Memorial Sloan Kettering Cancer Center in New York City. Dr. Burke serves as Associate Chair of the U.S. Oncology Hematology Research Program. He is a current ASCO member and is on their Clinician Wellbeing Task Force. A couple of notes on this evening's agenda. We'll begin with a presentation from Karen and Dr. Wilson on the SafeHaven resources, and we'll begin our panel discussion and a Q&A following that. Before I turn it over, I wanted to go over a few housekeeping items. If you'd like to ask a question, please utilize the Q&A function at the bottom of the Zoom screen. If we don't get to your question tonight, please email us at info@safehavenhealth.org. I think somebody's adding that to the chat, so you have access to it just in case. But we will do our best to get to every question. I also, before I turn the slides over, I really want to talk for a second about our relationship with VITAL WorkLife. We did a lot of research after we passed the legislation for protections to find the right partner for this. We had always had in our mind that we wanted a national program, and we wanted a group that had a national reach for anonymity reasons where you practice medicine. but we also wanted to make sure that we had a partner who had specific and a long history in treating physicians and nurses, people in healthcare, because each of you has to deal with some very unique situations. And I'm just so proud to say that Vital WorkLife fits every bill. They really are fantastic and they provide incredible services. They have a national team of physician peer coaches and senior behavioral health consultants. They have more than 15 years of dedicated physician well-being experience and programming. And they've just shown us real results and proven outcomes. I cannot say enough about them. And I think you're going to enjoy learning about them, but also working with them. So with that, I would like to turn the presentation over to Dr. Wilson and Karen.
Thank you so much, Melina, and thank you everyone for taking your time to engage with us this evening. And so, I think with that introduction, I just feel so honored to talk a little bit about what we do. And, Melina mentioned that we have over 15 years serving physicians and clinicians and their family members. And, that's one of the things that was pretty compelling for me about Vital WorkLife. We have been leading the support of physicians and their family members and clinicians and their family members. And so part of what I want us to talk through as we look at what's on the screen, we offer holistic solutions. We recognize that human beings are complex and our needs are complex. We're, multidimensional beings. And so the solutions and the tools that we offer recognize that and really speak to that. And so we have solutions and tools that are really designated to building your resilience and resolving and mitigating burnout. And so we're going to cover briefly the solutions and tools that we offer that, again, are available for you and your family members. And so I'm going to jump in and we'll talk about them individually, and then I'll turn over to Dr. Susan Wilson, who delve in more detail into the peer coaching element of it. And so I'm going to start off just kind of looking at our diagram. We have counseling, we have coaching, we have leadership development, a virtual concierge, and I'll talk a little bit about these in some detail, because I think these are the pieces that help with stresses, whether they're high stressors or low stressors, really can help with managing your life and figuring out how do you balance all the obligations that you have. So let's jump in. I'm going to start with the counseling and support, and we have a national bench of licensed behavioral health professionals across the U.S. to meet the needs of our physicians and clinicians. And so you will be approved for 6 sessions if you were to call in. And one of the unique pieces that we have as well, not only are you able to connect with a behavioral health consultant for 6 sessions, you can get in the moment support. So if there's something going on that's particularly stressful, you can call and speak to someone. And this is outside of the 6 sessions that you would have with one-on-one with a counselor. And we really vet our network closely. We have individuals people who know healthcare, people who understand the joys and challenges of healthcare, and people who are flexible in their ability to schedule. The work that we do is non-diagnostic, and so that's really a core component of it as well. We're doing non-diagnostic work that's supportive, and so that when you meet with one of our behavioral health consultants, they're able to speak with you, support you, and there's no coding or reporting to any sorts of organizations. And I think if you do need that, because sometimes that's at play in our circumstances, then they're able to make referrals for you. And so counseling support's available for you and your family, up to 6 sessions available virtually, which most people are preferring right now. And we can also accommodate in person if that's a preference for you. Parenting coaching is one of our newer tools, and we found just so much utilization for parenting coaching. And think about it. If you are parenting and you're challenged, if there are concerns that you have, it goes with you wherever you go. So you show up to work, you're concerned about a child. We do have someone who can help with parenting coaching. And the individuals that we have understand human development, understand parenting and discipline, and they're experts in that field. And so again, 6 sessions are available for you if this is something that you would like to utilize. And again, really, I think we've been really surprised and stunned and really appreciative just how much utilization this has gotten since we introduced it. One of my favorite tools to talk about is our WorkLife Concierge, or we sometimes call it WorkLife Assistant. Think about what it means to have some of these tasks handled for you. You need something done at your home. You don't have time to vet contractors. You can call and they would do that kind of work for you. Take the legwork out and really handling these tasks that can add stress. And so think about it. Meal prep delivery services, if you wanted to find one, if you had errands and other things to do, if you're trying to plan a celebration for a family member. One of the ways I know that individuals use it to find options for travel or vacation. If you want to take your family somewhere, you don't have time to book tickets, to identify, to find rooms for accommodation, they can take care of that. My favorite story to share about this was during I think last year during the Taylor Swift debacle when people were trying to find tickets for that concert. Someone called us back to say, I was able to call the concierge and get tickets when nobody else could. And so really a helpful service that can, again, take away some of the heaviness of obligations that have to be done, given that your schedules are pretty busy. And then, of course, you have available legal and financial resources. You have unlimited financial consultations with experts, people who understand finances, people who know about budgeting, understand what it means to plan, how to do estate planning and wills, and you have unlimited consultations. For legal services, you have 30-minute consultations at no cost with an attorney. And of course, covering a variety of issues, family issues, property and contracts, criminal, and of course, personal injury as well. And then we also have a suite of resources available for you online related to financial and legal functioning and legal planning. And so there's just so much. And, I know we have limited time, but I'm hoping you're getting just kind of a glimpse of what's available to you. And then where we want to spend a little bit of time, pair coaching. I mentioned that we have counseling. We also have pair coaching available for you. And you have up to 6 confidential sessions with a physician pair coach. And again, this is also like our counseling. You have up to 6 sessions, and it's also where a space that's safe, where there's no reporting back. You decide how you use these sessions. And if the coach and in the working with the coach and connecting with the coach, there's a sense that, maybe you do need some therapeutic support, the coach is able to do that as well. And I wanted just to talk a little bit about the specializations of our coaches. We have quite a wide bench of coaches who are a part of so many different areas of specialization. So we have anesthesiology, cardiology. I'm not going to read through the list, but if there are, I know for some of the individuals who reach out to us, they want to connect with someone who understands their area of specialization. And so we do our best to honor that. And part of the way that we do that is to have a wide bench of coaches available. And it may be that you want to explore, you want to connect with someone in an area you would like to explore, then that's an option for you too. And so we really like to share this because I think for people, it becomes just, we put sort of flesh on the theory or flesh on the bones, and you can see who we have and get a sense of who you can connect with. And I know that Dr. Wilson's going to talk a little bit more about this, but all of our coaches are certified. And so that means that they have skills and training to provide coaching for their peers. And the topics are endless. There's so many reasons, and then Dr. Wilson will talk about that, so many reasons people come to coaching. And there are just a few here. budget coaching, career development, leadership development. So many times individuals are thrown into leadership without adequate preparation. And so if that's something that you would like information about or like support around, we do have coaches with skills in this area, in many different areas. And so at this point, I'm going to turn over to Dr. Wilson. She's going to talk a little bit more about what coaching is, what a coach does, what is coaching in general, and we welcome questions as well. So thank you, and take it away, Dr. Wilson.
Thanks, Karen. Well, it's great to be here and to hopefully share with all of you some of the great tools that Vital WorkLife offers. So as you've heard, I am a retired emergency medicine physician, subsequently came to the world of coaching because I really still wanted to be involved in healthcare. And so really learned about coaching and what it is through some of the certifications that I've done. So what is a coach? I do find that a lot of people in medicine have heard the term, but don't really necessarily know what is coaching all about. And it's really important to think about a coach as someone that's really collaborating with you. The coach is really just helping to guide the client, the coachee, to self-discovery in areas of fulfillment, balance, process. We kind of think about coaching as moving people forward and helping a client look to their future and helping them forward the action. As mentioned earlier, there are just a myriad of topics that can be covered in coaching, and it really is all about what is important to you, what you really want to focus on, and what you see maybe as a challenge or what you see as a goal that you want to achieve in the future. And so really addressing personal or professional goals is all part of the process. Now, a lot of people wonder, well, what is really the difference between coaching and therapy? It's very interesting. As I just mentioned, coaching is really a chance to move forward. You know, you're at a point in time, you're here in the present moment. Coaching is really helping people look towards the future and helping them set goals and helping them to get beyond maybe a challenge that they're facing currently. The coach really assumes that their client is whole, resourceful, and creative. You know, there's nothing wrong with you. You're just really trying to maximize your potential as a human being. And so coaching is just kind of helping you forward that action. And therapy really is more focused on looking in the rearview mirror, so to speak. So this idea of maybe exploring what happened in the past that is maybe now accounting for what's going on right now, the current problem. The other thing with therapy is I think there is also an emphasis on thinking about, well, is there some kind of a mental health issue that is causing this situation? Does this person have depression? Do they have severe anxiety? Do they have, you know, debilitating stress? And so the difference between coaching and therapy, again, coaching moving forward, therapy maybe looking in the rearview mirror and thinking and seeing if maybe there's something that's causing some of the distress the client is feeling. One interesting thing about coaching and therapy is many people find a benefit in using them both, either simultaneously or maybe doing some therapy initially and then doing some coaching. So that's another avenue to really think about, that there's maybe situations where both therapy and coaching would be very beneficial. And then finally, I wanted to just mention a little bit about resiliency. I know all of us in healthcare, you know, we hear all the time about, okay, how can you be more resilient? Or let's train you on resiliency. And we all know that we as people in healthcare are probably some of the most resilient people in the general population to begin with. But strategies to try to maintain your resiliency or develop it even further than it already is are the following that are listed here. So this idea of getting connected, you know, instead of just sort of being a loner, being really able to embrace relationships with those around you, making every day meaningful, really finding something in every day that you're grateful for, or that you can be really observant of. Mindfulness comes to mind when I think about everything being meaningful. Learning from experience. So, if something bad happens, as we all can think of situations like that, being able to take a step back and think about, okay, what have I learned from this? And now I'm moving forward. Remaining hopeful, right? I mean, always knowing that, there can be a silver lining behind things, and being able to be positive and be hopeful. Taking care of yourself, I think, is really important. And I think so many of us put our own needs second to those of our patients, our colleagues, the people we work with. And so this idea of really being able to set boundaries when you have to, and taking care of yourself, and really filling up your own cup before you then in turn can do for others. And finally, this idea of being proactive. So instead of just reacting to something that's happened, maybe anticipating something that's going to happen, and being able to maybe protect yourself a little bit from that situation, or proactively take some action so that you can get through the situation.
Thank you, Dr. Wilson, for those strategies. And as you were going through it, I think what crossed my mind, and I'll just go back to that, was just the idea of paying attention to these strategies and really asking that question of, where am I doing okay? Where do I need to put some more effort or work, and being mindful of it in that way. So I'm hoping that our participants are able to think about it, because I think these strategies are helpful, really meaningful, and it's okay to celebrate where you're doing well and to plan for the areas that you may need to enhance or strengthen. And so as we think about getting you connected to us and getting you using these resources to enhance your resilience and to boost your well-being, wanted to invite you to download our app if you haven't done so. And so we do have the QR code on the screen. Feel free to go ahead and grab it. And, one of the good things about having the app is that you are able to complete assessments, and they're all personalized and tailored for you. You're able to set goals and track those goals. And so there are just so many rich resources embedded if you were able to have the app at your disposal. And it's right there on your phone. You can use it. You can check in on yourself. You can connect with us for coaching. You can connect with us for counseling, or connect to use the virtual concierge. And so if you haven't done it, go ahead and grab it. We'll leave that slide up just for a little while longer, and so that you're able to get what you need. And using the app, the information that you put there is confidential as well. We do not collect your data or any personalized information. And so in all of that, again, we want to make sure that you're able to connect with us quickly and efficiently and get the support that you need. And so we also have your ability to enroll.
Oh, I'm happy to talk about that. We'll leave this up and we'll put it back up, but it's very easy for you to use your phone to scan this code right from the screen, and that will take you to the ASCO website, where you can specifically enroll in the program. As you know, ASCO is very generously paying for a good portion of this service for you, and it's a confidential service. It's designed to make sure you're comfortable and it's accessible for you, and I really encourage you to do it. I think we have finished with most of the presentation here. Is that right, Karen?
Yes, it is.
Perfect. I just want to make sure I didn't cut you off. I know that we already have a couple of questions that have come in. And if you're comfortable, I think a few of them, especially these first few, Karen, are for you. So I'll just read the first one. I don't see oncology and oncology subspecialties listed on the slide. ASCO members are all oncology professionals. Are any of the peer coaches in oncology?
I'm thinking about our list right now, and I do not think we have any one who is in oncology, but we're looking, and we have actually made that a priority. And so
I will just add that the Medical Society of Virginia has also offered a new partnership to train peer coaches, physician peer coaches, in a partnership with Georgetown University. And we have our cohort open now. If anybody is interested who's an oncologist, please let us know. But I will also say from experience that we've had doctors talk to people in other specialties, and they found that that is just as meaningful. It may not be as specific, but the perspective of somebody who's been trained as a coach and a physician has special clarity. Dr. Wilson, I don't know if you'd want to speak to that at all.
Yeah, I would love to speak to that. So interestingly, I would say that the vast majority of my coaching clients have not been emergency medicine physicians. And I think the important piece is having a physician coach who really does understand the environment of medicine and, the culture of medicine and what we're all going through. And so I do think that although it is, of course, it's probably really nice, like for an OB-GYN to be able to talk to another OB-GYN coach, it's not necessary. It isn't necessarily a prerequisite for effective coaching. So I would say that I think the important thing is someone that is in medicine that understands what the person is going through and can relate.
I couldn't agree more.
yeah, thank you both.
We have another question in the Q&A. How are the counselors in your network selected? Karen, probably you. No.
Yes. So we typically are looking for individuals who are licensed with at least 7 years experience. So at the master's or doctoral level, and individuals who understand healthcare, and so who have worked in healthcare, whether hospital-based, and who have seen healthcare team members, who have seen physicians, and who understand the need for flexibility, who understand the need in terms of just the environment that people are working in. And so we typically are not taking new grads, or we want tenured individuals who understand workplace and what it means to support individuals who work with in a stressful environment.
So helpful. The third question in the Q&A is, can you explain the difference between or relationship between SafeHaven and VITAL WorkLife? Are these anonymous or synonymous, excuse me? Is one a subsidiary of the other? If you all don't mind, I'll take that one. And Karen, if you want to add, please do. So the Medical Society of Virginia founded SafeHaven as a program, and it's a trademarked program. And we approached VITAL WorkLife that was already I think a 30-year company doing incredible work in this space. We actually did quite a bit of research on everybody providing behavioral health support in the space as we were looking for a partner. And after vetting them, we realized they were the right partner for us. So we actually have a partnership where we work with other state medical societies and national specialty societies to bring protected offerings to states and to subspecialties, and to make sure that not only people have this sense of confidence in the confidentiality, but anonymity and protections in each state. We're working to bring those legally to every state. We then also offer the services and these services to you via Vital WorkLife. And MSV, the medical society that runs SafeHaven, doesn't ever have any access to the information, who calls, who talks, what anything goes on. Neither does ASCO, Vital WorkLife. We have signed agreements that we don't want to know. We don't get that information, and they have agreed to hold that information confidentially and in with very strict protocols. They made just some small tweaks to their normal processes to comply. Karen, would you add anything to that?
Well said. I think the foundational piece of what we do is making sure that it's private and confidential. And so it would not work if we were reporting back. And so I think our partnership is such that we are providing the services that SafeHaven and MSV have longed for clinicians. And so we're honored to do it, and we do it. It's sort of, I often tell people we're operating sort of in a vault, so that you come to us and we provide what you need, and we're doing so sort of through the partnership that we have, but there's no information going back and forth.
That's right. That's right. Just another note before I ask some other questions, ASCO will cover 80% of the cost of the service to the first 1,000 members who enroll, offering it for only $75 for the 18-month pilot program. $75 would be the cost to you to join up. Your benefits will begin upon enrollment and continue through August of 2024. So I really encourage you to do that and I know a lot of people have already signed up, so I encourage you to do it. And then I think we have a few more questions. If you don't mind, I'll just ask. The first, I wonder, Dr. Burke, we have not heard from you yet, and I wanted to just bring you into the conversation. Could you briefly share why ASCO is offering SafeHaven, the clinician well-being resources, to its members?
Sure. Thanks. And thanks for the great presentations, guys. I think to my understanding, and this goes back several years, there's been increased recognition of burnout being a problem among physicians in general and oncologists in particular. And I think burnout among oncologists has a lot of negative impacts, or not just for the oncologists themselves, but for the physician-patient relationship, and increased turnover among oncology practices, early retirement of much needed people to provide care for patients, et cetera. And so a number of years ago, the ethics committee of ASCO convened a roundtable to sort of address these issues. And one of the recommendations coming from that roundtable was that ASCO should create some resources to help its members reduce and prevent burnout. And all that was sort of published as the outcome of this roundtable in 2019. And of course, we all know what happened at the beginning of 2020 with the onset of the COVID-19 pandemic that did not help matters in the slightest. And during that year, ASCO created a task force sort of designed to help with the well-being of its members. And I've been sort of a volunteer on that task force now for a few years, and our task force initially made a commitment to increase resources to help promote and support the well-being of oncology professionals in our country. So I think, this is really in ASCO's interest to reduce burnout, promote well-being of its members, and to help create a workforce of clinicians, both oncologists and non-oncologists, but who take care of cancer patients, who have the lowest rates of burnout possible, and really that's only going to lead to better care for patients. So there's a long-winded answer of, I think, why ASCO has a real interest in minimizing burnout and maximizing the well-being of oncologists and other clinicians that provide care for cancer patients.
That's great. That's great. Do you mind if I ask you about what led you to want to be part of the well-being committee and to volunteer to be a SafeHaven Vital WorkLife well-being advocate?
Yeah.
It's a lot of personal time.
I think the main reason is it was a desire to kind of give back to ASCO. So I served on the ethics committee for a few years, and when the opportunity to join this well-being task force came up, I said, "Yeah, I'll do what I can to really sort of give back to ASCO, which has done so much for me in my career." So it was really just that. And it became sort of a topic of conversation among my practice. So I'm in a big sort of large group in Colorado, and we were talking about it sort of independently of everything ASCO is doing. That we have some issues with some of our docs having burnout problems, and so it really does sort of strikes a chord, here close to home, and I think so. Those were the real main reasons I got involved, and then when the opportunity to sort of be an advocate for this came up, I mean, I cannot, to be honest, can't believe, the amount of stuff that Karen, you presented about what opportunities we have. I mean, the counseling, the support, the work-life concierge, the peer coaching, the general coaching, the legal and financial resources. I mean, this program is truly unbelievable, and the opportunity to sort of be a part of that. So I'm still very green. I'm still learning how it all works and what everything does. So I don't have a lot of experience with the program itself, but it's really quite amazing that we have this opportunity to participate in that at a low cost for ASCO members. So, I would say as an oncologist, it's greatly appreciated to have this opportunity, and it's just, I feel quite fortunate to be able to be a part of it.
Well, it was a humble way to say all that. So, but I just want to tell you, you're already being a great advocate.
Okay.
I love it.
Yes.
I'll just throw a question to Dr. Wilson. I know you presented on some of this, but what are the types of concerns that coaching can help me with?
Well, so really there's a myriad of things. So I think Karen had put up a slide that kind of listed some of these. Certainly we all think of burnout, work-life balance, but even before you're burnt out, job satisfaction. I do think it's really interesting that there are many people that come to coaching for professional reasons. Maybe they do feel, oh, I'm burnt out, or I'm really having a hard time balancing my work and life, and then very quickly find there are personal issues that really are challenges for them that they really want some help with in coaching. So definitely there's personal things, and I think parenting was mentioned earlier. Maybe relationships. So those are examples. Getting back more into the professional realm, as you're transitioning through your career, I find that that's something that's really important for a lot of physicians. Maybe the 50-plus-year-old physician that's thinking about, okay, what's next? What does retirement look like? Leadership, as people are taking on roles in leadership, how do they learn to be a great leader? How do they transition into that role? Great.
That's super helpful.
And maybe I can add on something. I mean, coming from a background of amateur athletics, where, in athletics, everyone has a coach, right? I mean, from the top professionals, and you name the sport, they all have a coach. And in some areas, even, amateur athletics, it's very common now to get a coach, even to help a joker like me with my cycling, with my goals, and sort of get better, even though I'm never going to ride in the Tour de France. And so, a lot of professionals apply this in their professional life, but doctors don't, right? I mean, how many doctors out there have coaches to help them with their careers? And probably very few. But so what a great opportunity to sort of apply, someone with, take someone with Susan's skills and have her, help me sort of with career, goals, or whatever my goals are in my career. And so, I mean, I think this is just a tremendous opportunity to sort of apply what other fields are already doing. We should be doing the same thing.
Right.
So, yeah.
Well, it's so interesting that you mentioned that, because the specific tool that I use with my clients is this idea of being mentally fit. And so if we think about the analogy of physical fitness and having a personal trainer in the gym for your physical fitness, thinking about learning how to become mentally fit, and the coach really is the personal trainer to help you figure out, how do I become mentally fit? So yeah, I love that, really thinking of this that way. Just, yeah, we're just the personal trainer for that position and helping them navigate through their career and being a better person, being the
Yeah.
best that they can be.
And
Yeah.
you can be the world's greatest oncologist, but still benefit from a coach, to help you with all
Right.
these things. So yeah.
It's been very normal in the business community for over a decade to
Yeah.
have coaches. I've had a business coach. It's interesting.
I think doctors are behind in this. So
Yeah, yeah. And they deserve it. They deserve this kind of attention and care. Karen, once someone signs on and creates their profile and then reaches out for counseling services or coaching services, how will they be best matched with a counselor or a coach?
Yeah, for our counseling, and I'll start there and then move into the coaching. Uh, Given sort of where we are as a society, there's a significant shortage. Part of what we try to expedite the process, and so we're looking at we collect basic information, and usually if you're doing it online, we have exactly what we need. We need your zip code so that we can help find someone, because most counselors are limited by licensure law, so they can practice within specific states. And so we're looking at where are you, and then what are the core concerns that you're bringing to the process. And then we look at our panel to see who has expertise in the areas that you're bringing forward and who fits within the state that you may be in. And then we make the match in that way. And we're able to connect you once we have the basic information that we need. We can connect you right away to the counselor. And usually you're getting that email within 24 to 48 hours of saying, this is the person we've connected you to. You may go ahead and make contact. So that's for the counseling. With the coaching, our process is a little more refined in that what we're doing, we typically do an intake. And so we want to collect a little bit more info. And usually I'm doing those. And we can get you set up with those. Once you sign up, you can get on my schedule, typically within a day or two. And then we get you connected to the coach. We try to give people options for choosing a coach as well, because we have less of a shortage in that area. And so we offer the opportunity to choose from a short list of maybe 2 or 3, and then we get you connected. And so typically the turnaround time is about the same, maybe 24 hours after giving us the information that we need. And so it's usually, we found individuals who said, oh, I tried to do this on my own. I went through my own PCP trying to get a counselor, and they gave me a 3 or 4 week waiting time, and they've been able to see within 1 week. And so, so I think because of our network, our vast network, we're able to get people connected pretty soon, even for counseling where there's a shortage.
That's perfect. And family members can use the program as well.
Yes, family members can access any part of this program, and you tell us who's your family. So it's not a narrow definition. So we've had people say, well, what about my child in college in another state? If that person can use the service too. What about my parent on the other side of the country? Yes, they can use it too. And so they would just need to call in and let us know they're using it through you.
That's perfect. We have another question in the chat. Dr. Burke, while it was focused on you specifically, I might take some heat off of you and start to answer and then let you weigh in if you'd like. Providing physicians free counseling without the need to utilize insurance or without reporting addresses is an important need and meets that need. However, it is a Band-Aid for a more serious problem. Physicians are fearful that seeking mental health care may compromise their licensing or credentialing. Is ASCO considering lobbying for legislation that will protect physicians seeking mental health care? Currently, many physicians with mental health concerns are risking their lives to protect their livelihood. And I'll just start with this. The Medical Society of Virginia has taken on, and our board has specifically taken this on as a mission, not just in Virginia, but for the country, And it is what we've decided to do with SafeHaven. We did pass the first of these ever protections for physicians first, and now they applied to nurses, pharmacists, and medical students, nursing and pharmacy students. I expect that coverage to keep expanding, but this protection allows for legal protection as well as employment protection and anonymity, as well as protection around licensing and reporting until there's a point where somebody is not competent to practice, or they have signified in some way, signaled in some way that they are about to do harm to themselves or others. We've even in Virginia extended coverage for inpatient treatment for up to 30 days and it not be reportable. We have been working with many states across the country and the American Medical Society, or the American Medical Association, excuse me, to get this type of law passed in every state in the country. I'm very happy to say that the Physician Foundation also stepped up and provided some funding, where we are taking on, what they did is actually provide funding for 5 states to come into a cohort with us to pass this legislation, and we will work with them. We had so many applications that we are paying for a couple of more to come into the program because our board is so passionate about this and make sure we bring SafeHaven to more states. Our team has talked to 20 medical societies across the country to change the laws in each state. We aren't in a position to do this federally because of the way that medicine is managed at the local level. And I would tell you, just based on conversations with ASCO, they are very committed to supporting this kind of advocacy, I think. But we haven't, I don't think, discussed really involving them specifically in efforts. But if you want to bring it to your state and ASCO wants to be part of that, we would love it. And so, John, now I'm going to move it back to you and see if you want to add anything to that. I hope I didn't steal any thunder. I just didn't want you to feel that pressure.
No, I have nothing to add. So thank you for filling in. You're much wiser than I on these matters. So no, I don't have anything to add other than to say I don't know whether ASCO has in the past taken a formal position on this, but I cannot imagine they would not be supportive of everything that SafeHaven is doing. And thank you for all that's being done for that. So obviously a very important issue. Yep.
Thank you. And we really welcome anybody who wants to bring this to their state medical society. We are happy to talk to you and talk to them. So please, Taylor, would you please add mine or Dustin's email to the chat so that somebody could reach out if they wanted to us, if they were curious about it in the state. I appreciate that. Dr. Wilson, we're going to come back to you, and I'm going to ask you another question. I think we have a few more minutes left, and I want to take advantage of the time. I'll see if we can get 2 more questions in. What are some effective strategies to cope with stress or burnout?
So as I alluded to earlier, this idea of being mentally fit is really what I have really embraced, both for myself personally and what I'm helping my clients to really nurture in themselves. And so this idea of being mentally fit is the notion that you learn through mindfulness techniques how to shift your perspective from seeing things as just, being horrible, they're awful, things that make you feel angry or frustrated, to learning how to shift away from that and maybe being able to see, okay, how can this become an opportunity, or how can I be more creative in this situation? It's not the idea that you're toxically positive, but it's just an idea of learning how, again, when challenges come your way, when disappointments come at you, learning how to shift your focus away from them. So mindfulness is a big tool in the mental fitness work, and in general, this idea of just being present in the moment. Certainly, this idea of connecting with other people, and not isolating yourself, but really, again, nurturing relationships and having colleagues. I think that's very supportive of people in their struggles. Journaling, I think, is a really great thing, and just journaling about what are you grateful for, and again, trying to shift away from all the things that cause stress and anxiety. And one thing I just finally would say is, which I think about this a lot, is this idea that stress and anxiety really come from either ruminating about things in the past or worrying about things in the future. But when you really focus on being present in the moment, the stress and anxiety just kind of disappear. And I think about my own career in emergency medicine. If I walked into the ER and I was really worried about something, or something was really stressing me out, I observed that happening when I had to focus on that patient right in front of me, or something was happening right there, right in front of me, and I was just focused on that. All that other stress and anxiety just kind of dissipated. Maybe not permanently, but it did for a while. So there's a lot of different techniques. I think that, again, coaching can really help people to discover what works for them and help them find, maybe new solutions to those things.
It's a basket of tools, effectively.
Yes,
right.
A lot of tools.
A lot of tools. And last question, Karen. Currently, 6 sessions of counseling or coaching are made available to everybody through SafeHaven VITAL WorkLife. How does someone work through such difficult situations in such a small time frame? How does that work?
Yeah, we have skilled individuals who understand how to work in sort of a goal-oriented and solution-focused way. And so I'll say that to start, so that oftentimes we have found individuals may not use all of their 6 sessions. Certainly, we've had times where individuals need more than 6 sessions. And so what I say during that, in a situation like that, your organization has provided you an entry point of 6 sessions. And so I think part of what I often encourage people, if as you connect with the coach or the counselor, there's a sense that you need more, are you willing to invest beyond what your organization has provided for you? So most people are able to find resolution because, again, our coaches and our counselors understand brief solution-focused work. And we know that some individuals will need more than 6. And so I think just really being able to say, I had this entry point provided for me, this landing space where I could strategize and figure out what I need. And are you willing to invest? And one thing I will throw out there as well, if you're working on the same issue or the same concern, certainly you could continue with the coach or counselor if you wanted to. Again, it would require your willingness to make the investment. But I think I often say to individuals, the entry point and the landing space is provided for you. Are you willing to invest in yourself beyond that?
Yeah. And it's my understanding that, for instance, if I have one issue that's about me, but then maybe I'm having an issue with my teenager, that's a different 6 sessions.
It's a different issue or concern because it's per issue or concern. Yes. Very important point and important distinction.
Yeah. And life is messy. So sometimes we need to talk about different things.
Yes,
right?
definitely.
And some for short and some for long. And it's my understanding that it's typical that 2 or 3 sessions actually create quite a resolution with the majority of issues.
Majority of people.
Case,
yeah.
But it could, I found that even one of our physicians who was struggling through the COVID result had a couple of patients that she was counseling to get shots and get inoculated, and they just wouldn't, said they didn't leave their house, but they did, and they were quite elderly, and they both died within a week of one another. And I think it really affected her. And she had resolution and learned a lot of great strategies in the coaching session she had with happened to be a psychiatrist in one session, which I was really surprised. But she said, it really helped her reframe how she was dealing with that in just even one. I was surprised and
I
delighted.
think that's the benefit. And I think Dr. Wilson could speak to this too. Just sometimes in one session, people are able to find the sort of the release and then be able to strategize, or as she was mentioning, do that reframe. How do I need to look at this differently so that I'm living differently? So,
Yeah. Well, I just can't thank you all enough. You are an excellent panel. We are so lucky that you were here with us this evening. And I just want to thank everybody who's taken the time to attend. The questions were fantastic. I really appreciate the vibrant interaction. And we will post this for people to look at later. So feel free to revisit or share with friends. And just again, on the screen is that QR code. You can use your phone to scan and click on the link to take you right to the registration if you'd like to take part in all of this. And I just encourage you to, I will tell you already, we're seeing incredible utilization of the program by ASCO members. We see a 48% utilization rate across the board from all participants in SafeHaven, which is a phenomenal and unprecedented level. And already in a couple of months, we're already at 24% utilization for the people who've signed up through ASCO. And we see that it just grows over time. So people are enjoying it and it's useful. So thank you again. I appreciate everybody's time. Goodbye.